back. Hi, my name's Crystal. I'm a student nurse. I'm going to provide privacy. I'm going to wash my hands. And I don't need gloves yet for this part, but I will later. Can I have your name and date of birth?
Joe Smith, 10-5-53.
Okay, Joe, and your band says that. Do you have any allergies today?
Sulfa.
Sulfa? Okay, well, there's no sulfa in either of the two medications that we have to administer today, so you're good on that. I'm just checking. Today we're going to give you an IM for pain. So I'm just going to give you a shot for pain, and then I do have an active order for the medication. Can you tell me your pain level right now?
5.
5? Okay. And when was the last time you had medication?
5 hours ago.
5 hours ago. So then, I'm going to make sure I still have an active order, and I do. So we'll be giving you Trodadol, 30 milligrams IM for moderate to severe pain every 4 hours, and you had it 5 hours ago, so you're good for that. I'm going to have to, the vial says it's 15 milligrams, so I'm going to have to give you 2, so 32 milliliters altogether. So I'm just going to check integrity of my bag, or my syringes, and they're not open. Same with my blunt needle, and that's not open either. I'm going to check my medication for expiration, and it is good. It's 12/22, so that's good, and that's the Toradol. And after that, I'm going to do my 3 IM sites. So it would be backwards on me, but so my pinky would actually be up here. We go 3 down from the chromial process, and right there where my pinky is and my ring finger would be the shot area. You'll see there's a little triangle, and then we have the vas lateralis, aldus, adus, and so we'll have my hand up here on the ventral gluteal, or the greater trochanter, and then my bottom hand on the lateral condyle femur, and right in between you would give the shot. And then for the last part, this is where I'm going to be giving my shot today, I would put my hand on the greater trochanter, that's where my palm would be, and then my pointer finger would be pointing to the iliac spine, and my middle finger would be pointing to the iliac crest, and right here is where I'd give the medication. So then, today we're going to be using the Toradol, so that will be for moderate to severe pain, 30 milligrams IM every 4 hours. The common side effect is abnormal thinking, dizziness, headaches, exfluria, serious is stroke, IG bleeding, and myocardial infarction. The action is that it's going to help with severe pain, so hopefully it takes your pain away, and if not, you can tell us. We would assess the labs. The respiratory rates would be the labs that we would assess, and then so then I would put my gloves on. And then I'm going to open my bag or my syringe. Have a sterile field. And I'm going to open up my blunt needle, not touching the top. So then I would screw that. Put this back on because I need to clean the top of my vial for 30 seconds. Okay, and it's been 30 seconds, so that's good. and then I can put my blunt needle in there and draw back some. So then I'm going to put I'm going to pull back a little so I have some air so it's easier to get out. And then I'm going to, I'm going to do my first check, and that's going to be, I need 30 milligrams, so I'm going to need 2 milliliters of this. So then I'm going to check it against the MAR, Trilodone, 30 milligrams. I am for moderate to severe pain, so I'm going to have to double it so that I have 2 milliliters. And then I'll have, since it's a high alert drug, I'll have the other nurse in the room look at it and make sure that it's correct.
You have drawn up 2 milliliters of Toradol, which you have an order here for 30 milligrams Toradol, and since that is 15 milligrams per milliliter, you are good.
Okay. And then, so I'm just going to do my second check. Toradol, 30 milligrams, I am for moderate to severe pain. I'm going to have to double it because there's only 15 milligrams per milliliter, so I've got 2 milliliters in here. And then I'm going to do my 5 rights, so I'm going to do right patient, Joe, right medication, Toradol, right dose, 2 milliliters, 30 milligrams, right route, IM, and then right time. So then I'm going to do a third check against, and as I'm doing that, I'm going to, so I got Toradol, 30 milligrams, IM for moderate to severe pain. I've got 2 milliliters pulled back, so that's 30 milligrams. So I'm going to recap my blunt needle against a hard surface. Recap it. So then I'm going to take this off and disregard it into the sharps. So then I'm going to connect my actual needle, and I'll be using a 1-inch needle, which is actually a 18 to 25 gauge, and it's a 22 gauge today that we're going to be using because of the deep muscle in the ventral gluteal. So when we're doing that, I'm going to clean in a circular motion. So and then I can leave my alcohol pad there so I know where it's cleansed. And so then I'll let that dry as I'm waiting, and then I'm going to do a Z-track method. So I'm just going to lift the skin up towards while I do this, while I give the shot. So looks like it's dry now. So I'm going to uncap my needle. So then I'm going to do this with my opposite hand. And I can see where it's cleaned. So then I'm going to lift the skin up, so that I'm going to take it with this hand, and I'm going to make sure I aspirate first when I'm putting it in. So I'll pull back, and if I don't see blood, then I'm okay, in which I don't see blood. So then I'm going to do this. I'm going to slowly inject for 10 seconds, so 20 seconds altogether since there's 2 milliliters, and then Joe, you'll start to feel these medications kick in probably next 10-15 minutes or so, and if not, you can let us know. So 10 seconds, it's been about So then I'm going to wait another 10 seconds after that, just so that we don't have any leakage from the drug being pulled out with the syringe. Okay, and it's been 10 seconds. So then I'm going to pull out and then put a dry gauze there just for dry purposes, so just in case anything does leak out. So then normally we don't recap these, but I'm going to recap these for school purposes. Other than that, I would hit it against a hard surface and it would just inject the needle so it wouldn't be able to be used again. So I'm just going to put it against a hard surface. That's done, and I would put that back in the sharps. But for my case, I'm going to use it again, so I'm just going to put it on the side over there. Joe, is there anything else that I can do for you? I have time. No? Okay, well, I'll just be around the corner documenting, but I am going to document my mom, my initials, the time, and the site that I gave it at.